Hi, good evening, and welcome to the Southside Help Center, half an hour. I'm Kendall Moore. I'm sitting in today on behalf of Mr. Harold Cherry, who normally is here, and I have joining me today Miss Sherry Nolan, who oversees a number of our programs, and we're going to get into a little bit about what Sherry is here for today in just a moment. Let me begin by saying hello to all of you who are out there viewing us. We encourage you to give us a call at 312-738-1060. Betty Smith, who is the founder of the Southside Help Center, and also want to say hello to Vanessa Smith, who is the current executive director. Southside Help Center, we provide a number of different programs for individuals who are indigent and living in the community. That include, but are not limited to, prevention and positive outcomes and healthy alternatives. With that being said, tonight we are going to discuss breast cancer awareness. It's a tremendous thing that's going on in communities, and I recently learned some staggering numbers that is having a tremendous impact on African American women, particularly in the United States of America, and more specifically in the city of Chicago. Sherry Nolan is joining us now. Southside Help Center, we're embarking upon a number of new programs as it relates to breast cancer overall. And Sherry, welcome to today's program.
Thank you, Kendall.
Certainly appreciate you being here. When we talk about breast cancer, let's first start talking about the Black Woman's Health Imperative and Sister Reach and Southside Help Center and the programs we're doing there with that.
Yes, this is an initiative that Southside Help Center has. We've been fortunate to gain over the next 14 months. The Black Women's Health Imperatives, which is Sisters Reach Us, who are out of Washington, D.C., is the person that we subcontract with. Mm-hmm. And we're subcontracted with this particular organization to talk about healthcare disparities in the Black community. It's specific to breast cancer, cervical cancer, and HPV.
When we talk about those three things specifically, what type of numbers are we talking? And let's start with the breast cancer. I know I was having a conversation with you as early as yesterday. Yes. And if we can convey to the audience, it's just a tremendous disparity in the Roseland community alone.
Yes.
Yeah.
Talking about the numbers, I'm not going to really get into the exact numbers, but I can share this with you. Black women in Chicago have twice the risk of dying from breast cancer as white women. And this is not a case in other cities. We're talking about just Chicago. And so that's one of the reasons why the organization targeted Chicago. Atlanta is the other the other area that they're targeting. So in Chicago, and then those numbers in terms of Chicago, the greater Roseland community is what I'm learning, because a lot of times when we talk about Roseland community, Roseland is a very small area of that community, but the greater Roseland community, and that's encompassed of West Pullman, and Riverdale, that particular area, that's where the majority of the numbers of fatalities are coming from.
Breast cancer, ladies and gentlemen, it really is having a tremendous impact on the communities, again, not here just in the city of Chicago, but throughout the United States of America. Sherry, specifically the work that we will be doing from Southside Help Center, what is our goal, our aim, our mission to combat the disease and decrease it, if you will, or at least bring awareness to it?
Okay, thank you. One of the things that we will be doing is education. Some of the reasons why we feel that women are dying from breast cancer is because of lack of education and knowledge. Mm-hmm. Not knowing how to do a BSE. And a BSE is a breast self-examination, when I should do that. If I'm still ovulating or I still have my period, it's a week afterwards. Okay. And so knowing what a normal breast feels like versus when my breasts are abnormal. I need to know that. And so, again, it goes back to a lot of the things that we talk about, even with HIV prevention, is things that are taboo in our community. As Black women, sometimes we're okay with other people touching us, but we don't touch ourselves.
Sure.
In the way that's beneficial for us and our health. So what we're doing with this initiative is we will be doing education as we've been doing all along in the communities, but we've added HPV component as well as cervical cancer, because although breast cancer is not preventable, HPV and cervical cancer are. They're 100% preventable.
And let's talk a little bit about HPV so that folks can understand, because the acronym, many folks may not be familiar with it.
Okay. HPV is a human papillomavirus.
Okay.
And of course, one of the things that was really alarming to me when I went through the education myself was finding out that 80% of women have had HPV in their lifetime, and we never knew it because our body clears it. And so now, of course, a lot of people saying, well, what's up with this new Vagisil commercial? And that's where it's talking about women need to get vaccinated for HPV. Well, now we also know males that are sexually active can get vaccinated as well. But as we talk about HPV, the vaccination, what that does is it prevents us from having HPV. But they want you to, when it's most effective, it's before you start having sex.
Breast cancer, HPV. Give us a call here. We would love to take your phone calls. 312-738-1060 is the number. Sherry Nolan is joining us, and I'm Kendall Moore from Southside Health Center. The discussion on health disparities overall is always a tremendous thing, and oftentimes are conversations that we do not like to have in the community. These particular, and Sherry, are they diseases? What are they referred to as? Whether they're just ailments? What category do they actually fit in?
Well, HPV, it fits in the category of virus.
As a virus, gotcha.
But it's certain strands of HPV, and if you all want to learn more information, we want you to call in and set up a time, or set up a situation where we can come in and do more education. But it's certain strands of HPV that will lead to cervical cancer, that will lead to rectal cancer, that will lead to throat cancer. And so, those are more your cancers. And again, breast cancer is not preventable. Early detection is what we're trying to do more of. A lot of the deaths are because it's not enough early detection. So most of the times when the women find out that they have breast cancer, they're already in the late stage. And so it's already had an opportunity to spread. And so we're trying to find out what are some of those barriers or those issues. Some of them is healthcare. Right now, because of our economy, a lot of people have lost their jobs. They've lost their health care. So they do have programs, and a couple of the programs we've partnered with. Chicago Family Health, they have a program where they're targeting breast cancer and cervical cancer. And before the end of the show, I'll give you those telephone numbers so that if you need to have a a mammogram, and you don't have money, one of the qualifications is no insurance, no income. They really stress that. Then they have a navigation to be able to do that.
Okay. We have a call on the line right now. Hi, caller. Welcome to the Southside Health Center show. You are on the air. Go ahead. Caller, go ahead. You're on the air.
The question is, the young lady there, she just the young lady there just said that there's a higher incidence of breast cancer in the greater Roseland area.
Yes.
And I was wondering, do you have any idea what's causing that? I know the greater Roseland area used to be a very industrial town. Does that have something to do with it, or is it just something in the water, or what?
Well, that's one of the reasons why we're doing the work that we're doing, and we're partner with the Black Women's Health Imperative, Sister Reach Us out of DC, is to try to find out what's causing those particular numbers from rising the way that they are. Now, some of the feedback that I've gotten is just what you said, talking about because it used to be an industrial area. Some people feel it's things in the water, but again, that's why we really need a lot of research around finding out what really is causing it. But all we know today is that the numbers are there in terms of deaths with breast cancer.
And I certainly appreciate the question, because it's particularly as African Americans, we need to be more involved comprehensively and overall with what's going on with our health. We were having a discussion yesterday at Southside Help Center. And we did, it's information that we cannot necessarily conclude, but we certainly do figure that, there is, what is it called? Like the incinerary. It's very close in the greater Roseland area.
Yes.
There's also a water distillery factory somewhere within the area. So the research is necessary because for that many number of women to have, the breast cancers, HPV, it's just astounding, and just not enough work is done. Sherry, let's talk a little bit about detection. So when you go out, are you able to teach other folks? And I know there's a comprehensive wraparound way to, for a woman to examine themselves when it comes to breast cancer. Do you provide that type of training as well?
When we're out, and again, before we were blessed to have a partner organization to bring in a few extra dollars so we can be able to give out incentives and things of that nature. We were doing this initiative in the beauty salons, and how that works is we go in, we do a brief education, we talk about risk factors that you can control, risk factors that you can't control. And also in doing the presentations in the salons, we bring a model out.
Okay.
It's not a real breast, but it's one that feels almost like a real breast, so that women can understand what lumps feel like and be able to, feel and mash, because again, even with the breast model, sometimes women don't really want to push down on it hard. They want to be real gentle for whatever reason. We've asked why they so light with it, and they really don't tell us a lot of times, but teaching them how to mash down and actually get in there and feel for the lump so that they know what a lump feels like. We also showed them how to do different techniques. The one that is most effective is while in the shower or lying down. And again, it's teaching them when, so it can be consistent after your cycle. And one of the reasons why women want to do this after their cycle goes off is because the breasts are very tender during the time that they're ovulating. So you want to wait at least a week so that can pass and then be able to do that.
All right. Folks, I want to remind you that you can give us a call, at Southside Help Center to obtain more information about this specific project, as well as the other services that we do provide. Our website is www.southsidehelp.org, and our main office number where we can be reached is 773-445-5445. Give us a call here in the studio right now, 312-738-1060, with any questions that you may have regarding breast cancer, regarding HPV, and cervical cancer as well. Now, because we are specifically focusing on those 3 bullet points, we should not be remiss when it comes to African-American men as well, and the importance of men being able to be tested for cancer as well, from rectal to, I forget the other, to prostate. Tremendous, and it is not by happenstance that these things we always have the highest incidence rates. And when I say we, I'm particularly speaking about African Americans. When we talk about HIV and AIDS, when we talk about hypertension, when we talk about diabetes, when we talk about people just being poor, we're always the number one for the worst things in the world. You need to get involved with your health. You need to really educate yourselves so that we can stick around and become and heal the community from a holistic approach. Sherry, in my notes here, you actually go around and host house parties.
Yes.
Yeah, let's talk about that.
We're doing, through this initiative, it's a part of it, an education process that's called a Party of 5. And with the Party of 5, and I hope the phones light up after we talk about this, is you would bring, let's say for instance, if your mom had a couple of close friends, neighbors, other people that fit the age category.
And what's the age category?
You have a different level. Like for HPV, when we're talking about just The focus is primarily on HPV and cervical cancer. We're talking about from age 18 to 30.
Got it.
When we start talking about HPV, cervical cancer, and breast cancer, we're talking about 30 and up. However, if anyone has any symptoms, we'll also give them the same information in terms of where they can get screened as well.
Okay.
But just because of, in terms of risk factors where the studies have proven that they're more likely to show up, we kind of broke it up into categories like that. So the party of 5, you would say, well, hey, can you come in and we would like to have a party of 5. And so with the party of 5, you have your host and you have your other 4 participants. In this particular party, it's an educational party, but it doesn't really feel like an educational party because it's a lot of interactive exercises.
We bring a drink?
Well, if you want to bring drinks,
I'm in. No, okay.
then that's fine. Some of the parties of 5 have had wine and cheese.
Okay.
You just got the host has to kind of know the people that they're bringing in, things to kind of to draw them in. And again, we're drawing them in to get education. And I know sometimes you and I go back and forth about why do we have to always give incentives to people to learn about their health.
Yeah.
And, we probably all say that, especially those of us who are working in the field. But we know that providing some sort of incentive will get people interested. So for the party of 5, you will call me. We'd set it up. I'd come to your home or your community center. If you're having it at a house, make sure you have enough room so that people can kind of move around. In small, tight apartments, it might not work so well because it's some activities in it. So it's activity driven. So it's really important that we have enough space. Church organizations, social clubs, Greek fraternities and sororities.
Big shout out to the Qs.
We definitely welcome that. But the house party of 5, it allows us to go in where people feel comfortable, so that we can talk to them in their space. Because, you have to think about it, Mr. Moore. Sometimes people, when they're outside of their comfort zones is normally in their own homes or in their communities. Sometimes they don't ask as many questions. They don't get as involved. So when we're bringing it to you, it's a little different. So now I'm on your playing ground.
Gotcha.
And so we're very knowledgeable and we're very skilled as to how to work with people in their cultures. And so we're doing this because we want to do this. We hope that the phones ring off the hook. Wanting to sponsor a house party of 5.
Free house party. I'm kidding. A house party. And you give us a call at the main office again. 773-445-5445 is the number. I also want to take some time right now to mention the Southside Help Center's Valerie Smith Reed Scholarship Fund. We are hosting a golf outing, which will take place Saturday, August 13th. It's going to take place at the University Park Golf Club Conference Center. And it is with respect to Valerie Smith Reed, who, as a matter of fact, many may not know the story, lost her battle and transitioned in life to something very similar.
Breast cancer.
Breast cancer it is. And so we want to encourage folks to give us a call at Southside Help Center. Come on out Saturday, August 13th, and we're going to be out at the University Park Golf Club and Conference Center. We put a lot of resources into trying to save lives. Sherry, I know we got to get ready to wrap up in just a second. Give me a 1-minute wrap up. What should viewers take away from today's program?
Hopefully viewers will take away from the program the basic information that we've given, and definitely even if it's not calling us, go online, go to your library, start looking up risk factors for breast cancer and cervical cancer, and what is HPV. And why is it that I need to be vaccinated for HPV? Those are questions that people ask me when I come out. So I definitely charge the listeners to think about that. I told you that I would be giving telephone numbers if it was viewers out there that were interested.
And let's take our time so they can write it down, because I know when I'm at home, it's like, what did they just say? So go ahead, take your time.
Okay. The main number for everybody to know, and this is just not around breast cancer and cervical cancer, but any type of cancer, is the American Cancer Society, and their telephone number is 877-233-05 467, and that's the American Cancer Society. And if you would like a free breast cancer screening, of course, they have an age criteria. It's not my age criteria. It's the one that they have set for the program. You must be, for this next information I'm going to give you, you must be 40 to 64 years old, have no insurance, and living in Illinois. If you feel this is you, we urge you to call this number. It's 888-522-1282, which is the Illinois Women's Health Line. And if you have computers, then you can also go to www.allcapscancerscreening.illinois.gov. For the cervical cancers, that particular program, if you're 35 to 64, living in Illinois without insurance, you can receive free cervical cancer screenings. Because a lot of times when women start approaching 35 to 40 years old, they're beyond childbearing. I don't get birth control pills anymore, so I don't feel the need to go in to have a Pap smear done. Paps are very important, and the older you get, you need to, look to, it's something in addition to the regular Paps. They call it a liquid Pap, and I don't have a lot of the information here in the studio, and it'll take up a little bit more time, but you still need to receive a Pap smear so that you can make sure there's no abnormal cells there. So again, you would contact that number, 888-522-1282, if you're 35 to 64 and you're living in Illinois and you would like the cervical cancer screening.
And here's a few tips, too, that I would like for the viewers to take away from here. Just to start, overall, eating better, stop smoking. Get up, and you're watching this program, get up after we go off. No, I'm kidding, because my guy comes up next, Justin from the Haymarket Center. But, honestly, you understand where I'm going with this. We have the highest incidence and a lot of the disparities and a lot of unhealthy choices and outcomes because we are eating the high saturated foods. We are eating the high fructose corn syrups. We're taking our babies to the grocery to the gas station and feeding them hot Cheetos for breakfast and moon pies in the afternoon. Our young people, they're smoking a lot younger, and even some of the more mature, some of the elderly who began smoking at a very early age. We have to take our own health and be responsible for it ourselves, because people are not going to do it for us. I assure you of that. How can they get in contact with you, Ms. Nolan?
The same number that Mr. Moore gave out, but it's 773-701-4237 is my direct extension, or you may call the main extension, which is 773-445-5445.
All right, and I also want to mention again one more time that we are hosting the Valerie Smith Reed Scholarship Fund. We're going to be out at University Park Golf Club and Conference Center. It's located at 23520 Crawford Avenue, University Park. It's next Saturday, August 13th. You can contact us at Southside Help Center for more information on that. And also visit us on the website at www.southsidehelp.org. I want to thank Sherry Nolan for being here with me today.
Thank you, Mr. Moore, for inviting me.
Mr. Cherry will be back next week. Shauna Mitchell, who's working the phones, and we have two interns with us. Thank you so much for allowing us to be a part. Have a good night. Right? Yep. All right.